Right, hi, I'm Tony, and this is a video because I can't attend this meeting in June, which is oral health in a digital age. And clearly, it's something I'm very interested in. And how can AI help? Well, I've been using AI for a little while, and I asked it to make a poster. So, this is the poster. So, with all of this, just pause it if you want to have a little bit further knowledge. But basically, this AI can help us in a lot of ways, but it doesn't have a great deal of empathy, although they're trying to teach it. And as it shows there, it says our trained oral health guides give friendly, practical advice that's easy to understand and easy to use. I didn't write this; it was done by the ChatGPT, but it's learnt from what I've been going on about for the last 6 months when I use it. So years ago, well, over 5 years ago, I was a dentist and I was on the local dental committee for some time. So this was in 2017 when I wanted to rebuild our website because I thought that we could do a lot more if we actually collaborated and we just had a basic, a general website with some local parts to it. Anyway, no one wants you to. It's NIMBYism at its worst, and I didn't get very far. But we need something different, and this should work. So this is my idea. Again, it's about how we can improve our learning. So I made this really for FDs, after COVID. But so this in particular is about for care homes. So these are all people who can go into a care home, and there's how do they get access? What do they provide? Well, the reason I kind of got more interested, apart from her dad ending up with dementia in a care home, this is from 2 years ago, and quite a lot hasn't been done. But the thing is, of all the things that were there previously, none of them really have a big impact on your general health, but actually your mouth has a huge impact. So we know from COVID that people were dying prematurely and prior to COVID in care homes because of poor oral health related to pneumonias. And we now know there are a lot of other things apart from pneumonia. So what we need is something like this. We need someone to go in and just keep their mouth clean, and not being difficult. How difficult can it be? If all the other people can go in, surely a dental nurse can go in and just show people, or even better, clean people's teeth who can't do it themselves. But then, a carer can do it as well, just with some training. So that's what I think we should do. This is how we can do it. So we develop an oral health service so everyone can be involved in it. But when you say everyone, who? You need different groups. So for dentistry, as with most medical professions, it's a top-down organisation, when really we're leaving a lot of people out, and that's when you want some innovation and integration. And so that's what we should have. We should have something like this. So we could have an oral health service, right? And then underneath it, we'd have some facilitators to show people how they can clean people's mouths. So you're not training to be a dentist. You don't need 5 years to do that. When it comes to taking blood, you can learn how to take blood. It depends which site you go on, but it may well be a 6 weeks course if you start from scratch, but it may be a 1 day course if you're already a trained nurse. So in dentistry, as long as you're a trained dental nurse, there's a lot of things you can do, and with some extra training, you can do a lot more. So we want people to have access to care homes. So how do we do that? Well, we need, I've put this one in. So we need a committee to first to discuss how we're going to set up the health service, and we all need people involved in that. And that's the list I brought. And then I thought, oh, hang on, I forgot. Yeah, I needed to put in a lawyer. So instead of having the lawyers arrive after the event, let's just get a straightforward framework, which quite frankly is what the GDC should do for dentists, whereby you know where the boundaries are and they're quite clear of what we're trying to achieve. So that's, lawyers. We need a lawyer as well as everyone else. So when it comes to the oral health practitioners, which is generally, as you would say, trained dental nurses, and it can also be the trained oral health educators or oral health champions, as they're called, then I've made a site that has, as you can see there, how to start your own business, how to get some templates for standard operating procedures, joining the network and quick registration. So that's called dentalhealthservice.net that I've made, and it needs work, but it's a starting point. As I said, my dad got dementia. I made this site for when he got dementia because I couldn't help him. But I was well aware some of my patients were carers, and other people also went to the care home just to entertain and to chat to people. And there's an awful lot we can do as society, just doing different things. We just need to help one another. So as regards for that, if you go onto the website, which I'll have to change, I've made it on Weebly, I'm going to move it to WordPress, and I need some feedback to see what works and doesn't work. And to be honest, it's got too much in it because I originally made 20-minute videos, but carers don't have time. So there are about 6 of these sort of 5-minute slots with a 2-minute video. And as you can see there, it's from someone who I really admire for what they're trying to do. So that's for the practitioners. So for the facilitators, well, I can't do this. I've been to care homes a long time ago, but then we lost our funding. And so I never went in the last 15 years, I don't think. But I have been a lot more recently going around seeing how I can help. But this is Jane's company. So if you go there, you can get online courses or face-to-face courses. But this is someone who knows her way around care homes and provides the training for people who go to care homes, including the oral health champions. And really, we just need to know what the boundaries are because they can do a lot more. And this group, so this is a different group. We're trying to look after the vulnerable. So this is the opposite end of the spectrum. Where all the things I've put on my website apply. So they should have the silver diamond fluoride. We should have teledentistry. And the scanning we can use to help with caries diagnosis and just make it fun. So that's Nikki Rowland. The other one was Jane Patterson. And of course, they do it because they're passionate about it. So the actual service itself, oh yeah, I've done this. So it's just a website. And on the website then that I've made, is dentalhealthservice.org, you can find a service there. So you need to just be registered on it, and it's free to register. So the part is that as a dental nurse, you can register for free. And then as you can see there, you can be found on the map. So the map works. And then what you do is you select the service. So these are the services that are on there. And the ones above the red line are all things that dental nurses can do. Some need extra training and some probably not. And then the other part below that, they're things that a therapist can carry out. A hygienist is in between. And obviously a dentist can do all of this. But obviously a dentist is going to charge a bit more than a nurse. So anyway, so how would you pay for this? Well, the idea is, hopefully, is that I will get dentists to buy a website. And so I can make a website. Well, I have made a website, and the video shows it. And so anyone can have a website. We just know people just want to know where you are and what you charge. But a dentist can actually put the extra services on, which, clearly, if you want to have your teeth straightened and or you've lost one and you need an implant, then we're going to more likely to do that than to show someone how to clean their teeth, because quite frankly you earn a bit more money. But if people start paying for this website, I've already made the chatbot, but this chatbot here, I can make a single one where you can ask it any questions. So for the careforteeth.org, if you try that assistant there, it works pretty well. So that if dentists pay for this or someone wants to help, then I can develop this a lot quicker because, I was a dentist. I'm not an IT person. But the other part is there might be people out there who want to do the right thing. So clearly pay it forward. Well, I'm doing this big time because I'm doing this for nothing. But what we're trying to do is the knowledge that you get, you want to pass it on. And so frankly, you can't afford certain people. If you say, how much am I worth? Well, there are lots of people out there. So, for instance, the doctors, that they earn quite a lot of money. So, are you going to get a doctor to pay, or a dentist going in? How much would you pay them? Well, you should pay them nothing. They should, because they'll get more out of it, actually helping people in one way or another. And that's what we need with innovation. I need people who are good on IT, who've got retired, got a bit bored, and they can help me with this. So so on all my videos are on YouTube. They're free, and when I get stuck, I use this guy. There's another guy that I use called Tech Talk America, and they're brilliant. I haven't paid them any money, but they've been a massive help. And this one, Claude Hopkins, Wikipedia, I actually do start paying for Wikipedia now. And unfortunately, I think that'll probably, because of ChatGPT, may start to struggle. But if you look at Claude Hopkins, see, he has the biggest influence on dentistry more than anyone. And he worked in advertising. And this is free as well. So this is Nudge. So I subscribe to Nudge. Actually, no, it's free. And there are lots of other things. So the guy you want to follow, I really like, is Rory Sutherland. And most of his podcasts are free, and I've got his book. But basically, this is about human behavior, how we can get people to modify their habits. And this is just how you can get people to reframe what you're trying to do. And actually, this applies to all kinds of things. So this is a very small bottom-up business, and and lots of businesses work this way. You just empower the people about it, and so that's what you could have instead of having an oral health service. We were talking about having a community health service. Oh yeah, that's me again, right? But why not? And this is how it would work. It'd be called a preventive health service. It'd be exactly the same, and so no matter what field you're in, then I'm sure that you can set this up, and you can be found by using the same website on the dental health service.